Good afternoon, ladies and gentlemen. Y'all sure have come to order mighty quietly and professionally tonight. We welcome you to our this next go-round of our county budget hearings, and tonight we'll be hearing from our various departments as you present your budgets and your requests for additional funds. And we always say, if you're happy with your budget, you're free to leave anytime you want to. So I want to make that clear tonight. I don't see anybody getting up to go, but so we will call you in order, and those that are joining us virtually tonight through Facebook, YouTube, we welcome you to this process also. I continue to hear from folks who tune in and watch us on Facebook, and that's good to know that we're getting a little bit of a crowd out there. And thank again all of you for being here in person. And I guess you feel like you've been summoned to this process tonight, but it is a part of the process. It's a part of the time for you to explain why you have requested the budget that you have and what your needs are in your individual department. So welcome you. Last year, Ross Holt batted last. Tonight, Ross Holt is going to bat first. He's in leadoff spot with the library. You got the podium, Ross.
Well, thank you very much, Mr. Chairman, Commissioners. It's good to be here in person. Good to see you all face to face. Good to be here face to face with my fellow county department heads and colleagues. I realize I'm breaking a 10-year precedent by going first tonight instead of last. I asked for a special dispensation from Hal because the Landmark Commission has 2 designation requests before the City Council tonight. So after I finish here, in a little while, I'm going to head over there and present those. But it looks like I've kind of inspired a revolution as we appear to be going backwards through the budget book. So power to the people at the end of the book, and I guess apologies to the people at the front of the book this year.
Did they apologize to you last year?
or the year before?
Year before that. But I'll be brief. We are satisfied with our proposed budget. It's pretty much in line with the current year. We did ask for a small increase, $6,880, to cover retiree health insurance for part of the year, which Will has incorporated. The budget boosts funding for ebooks and e-audiobooks and e-magazines, which saw more than a 30% increase in usage during the pandemic, and supports much-needed collection overhauls at the Franklinville and Seagrove libraries. So that being the case, we'll take a quick moment to give you some updates about where we stand and where we're going from here. We're almost back to normal. We've restored regular services with no restrictions. Asheboro resumed evening hours this past Monday. Archdale will follow shortly. Franklinville and Seagrove have revised their hours to be open all day, most weekdays. They previously were open only in the afternoon, and those communities really wanted some morning hours at the library. So the manager out there has really done well taking care of that. The library is beginning to look like the library as people return and resume their pre-pandemic routines. We're beginning to see more people, in particular families with children and teenagers, coming to use our resources. I hope you have seen our incredible array of summer programs for everyone, but primarily for children. The goal of library summer reading programs is to offer kids fun, no-pressure ways to stay engaged with reading and learning over the summer when they're out of school, to avoid what they call the summer slide, where they're not as prepared to go back as they were when they left. And of course, this year it's even more important than ever as children and parents and schools cope with learning loss or the learning gap that has arisen during the pandemic. We're continuing our very popular virtual programming, but also bringing back in-person activities. We have over 130 events scheduled. About half are virtual and half are in-person. That's around the county. The mobile library is back on the road. The Extension Services librarians are safely taking it to their daycares and pre-Ks, resuming stops in some of the higher need areas that we've been focusing on, and we'll be doing more as the summer unfolds. At one of the stops, one teenager found the graphic novel section of the mobile library and told the librarians that she wanted to live in the mobile library. We'll also begin service to some seniors in some group residential settings. We have the lower 3 shelves are actually mobile book carts that we can remove and replace. So we can switch out the collection if we need to. So we're going to be doing some services to seniors. And I'd also like to note that we're trailblazers. Inspired by us, the Wayne County Library will be converting a retired ambulance into a mobile library in the coming year. So we were notified last week that we have received a $10,800 Library Services and Technology Act grant through the state library to place story walks along the Deep River Trail in Franklinville and the Paul Henry Smith Park in Liberty. Story walks are weatherproof panels, same thing you might see at like battlefields or something like that, that feature sequential pages from children's books. And you read the stories, you walk along the trail. The story walks will have books in both English and Spanish. The titles will be changed out every month or two, so there'll be new ones. The panels also will feature early literacy tips and techniques for parents. We expect to have the panels installed with books in them by January, and into spring we will be presenting programs in the park that incorporate the story walks. Our partners in this project are the towns of Franklinville and Liberty and the Partnership for Children. This is sort of a pilot project. We hope eventually to install these in parks around the county. The courthouse study, or the study for the courthouse museum is underway. Paxton and I have met with the architects here once and once virtually, and we expect that report shortly, so stay tuned for that. And then one last thing, we're in the final stages of a planning process that will result in a 5-year strategic plan for the library system. Commissioner Haywood is on our steering committee. We're working with a consultant, Susan Brown, who is director of the Chapel Hill Public Library. We had this in the works in early 2000, and when the pandemic hit, we decided to forge ahead, although it has made for an interesting process with some fits and starts. We've engaged elected and appointed local officials, library staff and supporters, leaders of community organizations, and we're holding focus groups of library users around the county. And right now, we're developing a plan. Our intent is that the plan is to be actionable, rooted in the community, useful for each branch as well as the library system as a whole, and includes an updated mission and vision to guide us for the next 5 years. Right now, we're seeking broad-based community input through a survey that's open for anyone to take at randolphlibrary.org/survey. And it's available on paper, too, in the library buildings. We want as much feedback as possible, including maybe especially from people who don't use the library, so we'll know why not. We want to find out why not. So please help us get the word about that. Take the survey yourselves. Share it with your social networks. randolphlibrary.org/survey. So that's the snapshot of where the library is right now. We're grateful for your continued support, and in particular, your support through this most difficult and unusual past year, and especially for the county's response to the crisis in helping us keep ourselves and our patrons safe and as healthy as possible. We're delighted to be back in action and ready for our next adventure. So if you have any questions, I'll be happy to answer them.
Okay, so I have a quick question. Back, I think in the fall, I was on the trail in Liberty and saw the story walk there. Is this grant for additional story walks?
Yes, I believe that one's at Freedom Park. The Liberty Library is very enterprising, and they put up some sort of do-it-yourself story walks. These will be, purchased fixtures and that kind of thing. So, and yes, I think that one's at Freedom, and this will add Paul Henry Smith Park.
Well, I thought it was delightful. They had done an admirable job. It was very enjoyable to go along and to read that.
And it fits with the county's goals of getting people out walking and into the parks, too.
Yep.
So.
I think the libraries are one of the best services that the county provides to our citizens all over the county.
Thank you very much.
And it's like working with Ramseur, getting them into new areas has really been exciting. And I know up my way, the day we opened back, there was coming in the door, waiting for us. So it's great.
All right, thank you.
Thank you, Ross. Is Damon Brown here, Child Support Services? Hey, here we go. Good evening.
Good afternoon to everyone. It's good to see each and every one of you. I'll be brief. I'd like to thank you for your continued support of our program. We're doing the best we can. We've made it through, just like everybody else, and we're pretty pleased about that.
Life went on pretty,
Yes.
continued to go on for you, didn't it, Damon?
Yes, sir. We're satisfied with the budget as it is presented to the board today, and I'll just take any questions if you have any.
Okay. Very good.
Thank you.
Thank you, Damon. Veteran Services, Mr. Gurley, you're up. Did Kenny make you put that jacket back on, Chad?
I had to. First and foremost, thank you guys. We appreciate everything that you are doing, chairman, commissioners, county manager, my cohorts. It's been a very, very difficult year, but we've come out of it. We've came out of it, and we have done everything we can to continue to serve our veterans and the dependents in Randolph County. I'll be brief. The mission statement again is to serve Randolph County veterans and their dependents, assuring that all claimants have consistent availability of qualified representation and assistance in obtaining benefits administered by the Department of Veteran Affairs. Some statistical progressions. County administration, thank you guys for expanding the staff from 2 full-time to 4 full-time personnel. We definitely needed it, and services are expanding even more. Myself and my veteran staff have obtained $5.6 million in this fiscal year for compensation benefits. We've also obtained $1.2 million in pension and aid in attendance, which is a benefit that is used to, I'm sorry, I'm supposed to click this. My apologies, guys. And I was trying to find a good animation, but I think that was the best I could do at the moment, so sorry about the slowness. Veteran office staff obtained $1.9 million in education benefits for this fiscal year, and our average appointment times are 24 hours. So if anybody calls for service, we typically serve them the same day in most cases. And there are some cases where we're going to need additional information, and we typically do that the next day or the day after. The budget request is very simple. We needed additional funding for advanced training and VA claims and adjudication for this next fiscal year. VA has evolved, and now they want to put a lot of the burden on the county to be able to do what they normally would do. So we definitely needed that additional funding to train staff that are coming in. And on that note, we've been working at half staff for the past 90 days with the retirement of one employee and the resignation of another. But we have 2 new service officers coming in on next Wednesday. One by the name of Kenneth Harville, who is a 21-year retiree, combat veteran, and Lisa Wright, which is an Air Force veteran of 10 years. So we are representing the people that we're serving in the county. And of course, Elizabeth Wood, who is going to be promoted to lead service officer, which I'm gonna talk about that in a little bit, to kind of undergird me and also be a second in command with the new succession plan that we're trying to accomplish in the department. Additional funding was also requested for supplementation of the veteran service programs, such as Vietnam War Veterans Day. I know Commissioner Haywood came through that drive-through event, County Manager Hal Johnson. Something that we never done before in Randolph County was to recognize those Vietnam veterans, and a lot of them really appreciated what we've done. A lot of them came and they cried through the drive-through, and they really appreciate the administration for thinking of them during that day, which again, March 29th is Vietnam Veterans Day, which is a national day that we recognize all Vietnam War veterans. Additional funding was also requested for computer hardware and software. The funds will aid in the purchase of a public computer to assist veterans and their dependents with va.gov portals, password resets, and the Board of Veteran Appeals teleconference hearings. Again, we talked about that burden of us sheltering what was going on with the federal government. So now what they're implementing is virtual teleconference hearings. So if a veteran appeals their claim to the Board of Veteran Appeals, they're coming to our office now and they're doing conferences in the office. So we're kind of splitting our time between serving veterans up front and representing the veterans during a virtual hearing while the judge is in DC. So that's something new that they're implementing. Also, additional funding was requested for publication and advertisement in order to bring additional awareness to veteran services. I found out through a lot of the surveys that we're doing internally that a lot of people just don't know we're here. So I'm doing extensive research and reaching out to our townships and letting them know, hey, you have a VA office right here in Asheboro. Send your veterans here. Do not send them to Winston-Salem. Don't send them anywhere else. We have qualified representation right here in the county. The continuation of the budget request in line with leadership succession. Of course, we have a director, myself, and then we have the 3 service officers. But I found it very important to have a lead service officer in place. So just in case, I'm out at a meeting or I have to go, in the community and do some work, we have somebody that's there that can take charge in my absence. So we requested to reclassify one of our service officer positions from a veteran service officer to a lead veteran service officer effective July 1st. Essentially, the lead veteran service officer will act as second in command to the director, and in his absence, the LVSO will maintain operations as well as supervise staff. Future initiatives. We want to extend services by 1 additional hour, 1 day a week for consumers who don't have the ability to schedule an appointment during normal business hours. So we do have veterans who can't make it between 8 and 5, so we were trying to extend at least 1 hour till 6 p.m., 6:30, so that way we give those individuals times to be served as well. And of course, I wanted to interface that with the county manager and the commissioners to see how we can accomplish that effectively and safely. We also wanted to, for future initiatives, to initiate a family and dependent wellness program, especially for our surviving spouses who have lost husbands and wives and they were married for years on end. And of course, we always talk about the veteran, but nobody ever talks about the spouse and supporting them and making sure we get them to the services that they need, both mental health, financial, and otherwise. So me and my team are getting together a pamphlet, a booklet that we can give that grieving spouse. If you need to go talk to Dave Mark, if you need to go here to get a gift card for food, we have something in place to give them other than just doing a claim. We also want to continue our annual Vietnam War Veterans Day commemorative event on every March 29th of every year. We want to continue to also honor other eras like World War II, Desert Storm, Desert Shield, post 9/11, and future era wars that may or may not come up. And also another thing that I felt that was very important is for us to do town hall meetings virtually. That way we can get information out to the community to let them know about different regulations and changes. One of the biggest ones is the Vietnam War Act, Heroes Act, where they're adding hypertension, Parkinsonism, and I think it's 3 other presumptives to the Agent Orange list. And there's a lot of veterans that are going to be impacted that served in the Vietnam War. Most importantly, we had a case that I was working on for a veteran who had hypertension. And before then, they kept denying it for years on end, especially after the Niemer Act of 2008. So the veteran ended up getting $136,000 retro pay because they had to go back from the time he had hypertension in the 70s to now. So we're doing a lot of that work. So they kind of call our office the money office. So we're making it happen on that end. And the last thing I want to say is, again, thank you guys for your considerable time. Thank Krista and her staff for always being available for us whenever we need to get DD-214s and death certificates, the property tax office, social services, and how we're working with them. Everybody, we're a team. And I say it all the time. I appreciate being a part of Randolph County. Sometimes it's bumpy, but we got each other's back, and I can definitely vouch for that. Thank you guys so much.
Thank you.
Absolutely.
Any questions for I go?
So are you going to the municipalities maybe to get on their agenda?
I am currently working on that because I know some of the townships are, we're getting back to that meeting in person thing. So I'm trying to talk to those town managers and other places to see if I can get in their area and do those things. But I am hitting the ground as soon as July 1st and getting in those communities and talking about this stuff.
Good. We're glad to have you here too.
Glad to be here. Thank you guys so much.
Thank you. Social Services, Tracy Murphy. Good evening.
Good evening. Good evening, Chairman Fry and Commissioners. As always, I am excited to be here to talk about work that I love with people that I respect and employees who are standing behind me that I appreciate. Before I get started, I would like my employees from Department of Social Services who are here to please stand. Come on, stand up.
Hey.
These are the professionals that keep the Department of Social Services wheels turning and make sure that we provide the mandatory services to the community that are required. And I am so appreciative of them and the hard work that they do. Despite challenges this year, despite not being allowed to work at home in their pajamas, despite having to run into homes where people may have had COVID or COVID symptoms, they have continued to come to work with passion and professionalism, and I appreciate them. Thank you guys so much.
Thank all of you. Thanks for what you do. Glad you could be a part of our process tonight.
Thank you. And I want to ask a favor. So my colleague, Sheriff Seabolt, and I are members of Leadership Randolph, and we had our mock commissioners meeting a week or so ago, and he was a commissioner, and he was not nice to me. So I had to say
You
that.
were being disruptive.
I do want to talk about Department of Social Services needs, things that's been going on in our community, and the requests that we've had in the budget this year. Our budget requests address 3 areas. We address child safety with our request, leadership, and Medicaid accuracy. I requested a total of 5 positions in this year's budget, and based on the needs of the community, we need those things in order to serve the public well. It is not news to you that our challenges were high this year, that they have been substantial. It's been a tough year, one of the toughest that I can remember. In our budget request, I requested 3 social work positions, and I want to talk just for a minute about why we need additional social work positions. In the first quarter of this fiscal year, July, August, and September, our legal team filed 11 petitions for children to come into care, along with our Child Protective Services investigators. So first 3 months, 11 children into care. The second quarter, October through December, when COVID was really ramping up, we more than doubled that number. 28 children came into care that next quarter. Third quarter, January through March, 51 children came into the care and custody of Randolph County Department of Social Services. So for youth entering foster care, that is usually a 12 to 24 month process for those children to be able to go home or to be, for us to work with parents to see if we can find a safe place for them. So they are in our care and custody once they come into the custody of Department of Social Services between 12 and 24 months. That is a very long process for those children and not something that we get out of quickly. An alternative to children coming into foster care is our Child Protective Services in-home program. So for those referrals, that is for children whom we hope that we can maintain safe in the home, wrapping community resources around them. Most of the children in Randolph County that we are providing in-home services to are not in the home of the biological parents. They're often placed in the home of a grandparent or an aunt, some trusted family member that's going to assist Department of Social Services, assist us with encouraging the parents to take advantage of resources in the community in hopes that that child can return home safely and not have to come into the care and custody of Department of Social Services. And as you see these numbers in front of you, for in-home services, May of 2020, we had 98 referrals. In May of 2021, 147 referrals. And I don't have it on here, but those 147 referrals is serving approximately 275 children. So a referral is a family. So 275 children in-home. So those are the numbers we are working with. I also have on this slide how our investigations have increased from the numbers that we were serving in 2020 to the amount of investigations that happen per month now. 150 per month. So at times that, because investigative assessment can take 45 to 60 days, we have 2 months assessments going on at one time. So that's a total of 300 assessments that my staff are handling, and sometimes, usually, each assessment has many more than one child, so anywhere from 300 to 600 children that we are trying to keep safe in assessments. So these numbers show the exploding caseloads that the staff are dealing with. And of course, we don't know, we can't really foretell what's going to happen, but I can tell you that once they are being served by Department of Social Services, that is not a quick process. And I neglected to say, with Child Protective Services in-home, we hope that those children are able to return home in between 6 to 12 months, or they have to enter foster care. So once children start in the system, they stay in the system for some time. And I don't want to characterize any child as the worst of the worst, but I have to be very honest with you with what happens with some of these children. I know that you are familiar with juvenile justice. Juvenile justice serves youth who are undisciplined and delinquent. And I don't know if you know the intersect between juvenile justice and Department of Social Services. At times we are called to court, and a youth who is undisciplined and delinquent is ordered into the custody of Department of Social Services. So juvenile justice can't handle an undisciplined youth, but Department of Social Services is tasked with that responsibility. Do you have any idea of what it is that we do with a child if we can't find foster home placement or a group home? What do you think happens with that child, and how do we keep them safe? Can't find a foster home, no group home will take them, they're undisciplined, they are having challenges with the delinquent system. So our staff on a rotating basis have to stay overnight and make sure that we're supervising that child. Most of the time they have behavioral health issues. You already know they're undisciplined, so it's a safety issue. So we are tasked with making sure that that child is safe, regardless of whether we have to ask staff who came into work that day to take on a rotating basis shifts to stay overnight with children. And we have one such child in our agency right now that we are working really hard to try and find a placement for, but they're difficult.
How do you recruit, Tracy? I mean, and do you have a list of possible families that you know they would consider having a child?
So we do have a good list of foster parents. You see the number of youth we have in foster care, 162 right now, but we have approximately less than 40 foster parents that are Randolph County foster parents. So as you see, those numbers don't add up. And our foster parents are very good, they're dedicated, but I have to be honest, the older children, teenagers, those who come from juvenile justice are very, very difficult to place. They destroy property, they assault people, so it's tough. So those are the types of cases we're dealing with, and we aren't minimizing the actions of our foster parents. They are excellent, but they are regular people just like you or I, and I wouldn't want someone who's undisciplined and who assaulted an officer and who destroyed property. I wouldn't want to bring them home with me either. So we have to work real hard in finding placement for those children. But it happens.
Tracy, could I take that a little further? When you're saying that if you can't find, and I'll try to speak in it, if you can't find a foster home for this child.
Or a placement, or a group home, or a behavioral health center.
And you're saying you have to replace your people to take care of this person.
That's correct.
In what facility?
So we have a visitation center where our parents come and visit our children, and we set them up there. If that's impossible, then we get a hotel room, and in rotating shifts, the staff come in and care for the child.
So you're telling me that if you have to get a hotel room, you got to pay for the hotel room,
That's correct.
and you have to have that employee, in essence, put themselves at risk in that hotel room with that child?
That's correct.
And you're placing your employees at risk?
So we try not to do that. We have them double up. We don't have them alone. We do different things to try and keep staff members safe. But yes, it does happen. At times, we can beg a foster parent, can we please allow the child to sleep at your house tonight? We'll keep them at the agency during the day. So we have excellent foster parents who are willing to work with us. If all else fails, we're staying overnight. We're supervising.
What if you can't place somebody in Randolph County? Do you use other counties?
Absolutely. We exhaust every avenue. Out of county, as a matter of fact, the children who have very high behavioral health needs, it could be out of state.
You could actually have them go out of state?
Out of state.
And so what you're asking for in some of your information here is when I say I need 5 more positions, these are the kind of positions that you're going to need to fulfill what your requirements are.
So I'm trying to understand why 5 sounds like a big number, but I'm trying to understand based on the increase in caseload and based on the complexity of the challenges that the children that we're serving have, why we need those additional positions.
And without being COVID required, and I'm sure it had some effect, are you seeing that society as a whole is creating this problem?
So,
And I know that's a leading kind of question, but still.
So the challenges in the community are still the challenges in the community. We still have a substance abuse problem here in Randolph County. We still have all the things that we had before the pandemic. But of course it's been exacerbated, and it feels like it's been put in a power keg and shaken up because children are home with parents who may or may not have been laid off, who may or may not be substance abusing, who may or may not be mentally ill. So all of those things is a recipe for exploding numbers that we're experiencing right now.
Do you have many of these kind of cases where you're putting your, I guess for lack of a better word, your people at risk with having to stay with that child, no matter what their, well, and I don't say no matter what their age, but you understand what I'm saying? There, you've got a older teenager or whatever.
So yes, we have children like that. We have children like that right now, and I don't want to belabor the fact, but my staff members put themselves out there and in potential danger regularly. Yesterday evening, we had staff members tromping through the woods to get a child. I mean, that's what we do. That is what our responsibility is, and that is what we do. We want to keep children safe, and we will do whatever we need to do to make sure that happens with what we have to work with.
I understand, and to follow up, Mr. Chairman, on your, I think, on your question about is how do you find the recruitment? How do you find the people that are willing to do these things?
Well, how do we find social workers?
Yep.
So you guys know I've been here before, and I've asked for lots of things to help with recruitment and retention. I've asked for sign-on bonuses. I've asked for retention bonuses. And we try and create a climate in the to support the staff in our office, and we work at that continually. It's an ongoing thing that we are always working towards.
So, are you finding a labor market?
We
Everybody's looking for help now.
Everybody's looking for work. I have to be honest, we are having some success. I have been before you before where I've said we have a 50% turnover rate. We do not have that currently. We have experienced some success with recruiting and retaining staff. And like I said, we are going to work very, very hard to make sure that we are doing that all the time, not just when the staff levels are low. but we want to concentrate on that all the time.
The one thing I want to point out, Mr. Chairman, on this, this is not somebody that would be serving hamburgers at Hardee's. These are people with master's degrees, is that not correct?
That's correct.
And I don't know what else right off the top of the head, but these are people that are highly educated, recruited people everywhere, I assume.
Do you have any resumes?
Yes, I do. Do I have some? One or two. You have one or two for me? Yes, you do. So I only have a couple more slides, and I do not want to take up more time than what's appropriate. But the state of Randolph County, I just have some data on here about what's going on in our community. Half the children in Randolph County are living in poor or low-income homes. You see there that 20% of children are living in households that are food insecure, and the median income in Randolph County is $47,000. With all of those things going on, with children going to school in the home with the parents, all of this led to what we talked about that's going on with the exploding caseloads with our children.
But let me make one more point if I could, and I don't want to belabor it. Mr. Chairman, I happen to know, unless it's changed, I happen to know a couple in Stanley County that is keeping one of the children from Randolph County because they don't have the capability here to keep that child, unless that's changed.
So we request any foster family from any surrounding county or even further away that we can, any foster family, we want children to be in a family if possible.
Sure.
Not just in Randolph County if we can't place them here. We want them with a family.
What's your Medicaid budget, Tracy?
I'm sorry?
Your Medicaid budget?
We still spend about $200 million a year for Medicaid beneficiaries, and you segued me right into this PowerPoint. Does anybody recognize this lady in the red suit?
Yes.
Beth Woods, our North Carolina State Auditor. And Ms. Woods is passionate about Medicaid. She's passionate about accountability. And she is one of the reasons that I'm asking for my Medicaid quality control position. Because of those $200 million in benefits, that is a lot of pieces of paper. That's a lot of evidence for our staff to have to keep up with. And we try real hard to do second party reviews because our staff are human, and human mistakes lead to inaccuracy. And Ms. Woods has increased the number of Medicaid audits. I know you guys are familiar with the single county audit. Department of Social Services is involved every single year because of the amount of money that we spend, but not just single county audits, the number of audits are increasing, and they are increasing in complexity. So our staff spend a lot of time making sure that those things are accurate and that there are no county paybacks. We have been very fortunate. Our team works very hard, our supervisors work very hard, and we have not had any type of large payback, but we want to make sure we put this on your radar because we don't want a large payback, and we want to put it in front of you so that you're aware that we are working really, really hard, but you can assist us with that to make sure that we don't have any county paybacks.
She is also a member of the Local Government Commission Board of Trustees and had some pretty hard questions when we went down asking for the $12 million too.
She's tough, that's what I can tell you. Her way of making sure that there's accountability for Medicaid is having more and more and more audits for Department of Social Services and the people who are managing that evidence. Last one. Our agency is a large and complex operation with many moving parts, and each team's needs are different and requires us to be versatile. It requires us to pivot quickly. And I have asked a lot in this budget year, but I want you to know how very much we have accomplished. Department of Social Services is the safety net for our community. We can't say no to a child that juvenile justice can't do anything with. We have to accept that child. We can't say no to an adult who needs someone to make medical decisions for them. And we can't say no to any citizen who wants to come into our office and apply for benefits. We're the safety net. We are here especially when times are tough. And times have been very, very tough for some of those in our community. I want to thank you already for the help that you have provided Department of Social Services, for the support that we've received thus far. I can tell you, I add my comments. I've heard my colleagues stand up here and talk about how leadership is supportive. Well, I can tell you, I sign on with that. Leadership has been very, very supportive. Thank you in advance, and I hope that you will seriously consider our request and positively approve the positions that are being requested. I am available to answer any questions, any further questions that you have, but before I do that, I see one of my board members back here, and I want to recognize him. Mr. Lassiter, thank you for being here. He is very, very supportive, along with Mr. McDowell. We have some of the best Department of Social Services board members who are engaged and passionate and work really hard with us. Thank you.
Thank you, Tracy, and thank you for your get-it-done attitude during the last year for all the difficulties, especially you and the health department folks. Your life went on every day. Those issues did not wane, go out of the way.
Right.
Tracy, one quick question. On Medicaid Transformation?
Yes.
How's that going to impact your budget, or will it at this point?
I'm not sure. And the reason I'm not sure is the 40,000 residents who are on Medicaid, probably about 27 to 29,000 of them will go into Medicaid managed care July 1. And of course the state did that to try and save money. And I don't know what that's going to look like after a year.
That was my concern, because it was done to save money. So they're looking to squeeze somebody, and some of the services you would provide might be included in that squeeze.
That was a really, really good question, and that's another reason why I'm very concerned. With the Medicaid audits right now, if we make a mistake, then what they ask us to pay back is just the cost of that person. If we made someone Medicaid eligible and they went to the doctor, then we just pay that doctor visit right now. But with Medicaid managed care, they pay an amount monthly for that citizen. So right now we believe we would have to pay back that large monthly amount instead of just that doctor's visit. So that could have a negative consequence on any possible paybacks.
And I will say, everything you said I'd taken in, but then when you introduced your board member, that you just ruined everything that you had done.
Thank you for you.
I got you back, Albert. Okay.
Well, can before you go, I want to make a statement about that point with the fact of the auditing situation and single audit requirements, because of the size of what they do in that department. You're always going to get a single audit type of requirement because of the volume, just sheer volume, which means they're going to get audited and they're going to get programs pulled and they're going to get looked at. And I don't think she can express enough about how important it is that everybody does the job and they double and triple look at things and stuff to keep it out, because if one of those audits has a mess up, it's going to make Will's job harder, because he's got to deal with the requirements that come on because of single audit requirements. So it's really important that all that paperwork is right, and it's really not fair, I admit, but they're the one that's going to get it, as opposed to other departments or other programs that are smaller.
Thank you, Commissioner McDowell. Next year, I'm having you do my presentation for me.
All right, public health, Tara. This is your first one.
No.
You're on the clock.
Good evening, Chairman Fry, Commissioners. I do echo the sentiments of my peers that I do appreciate the opportunity to speak to you guys tonight. and the support that you guys provide our department. I am going to preface my comments before I get into my comments about the budget. You know, I've been health director 10 days now, so it was not my idea to come before you and ask for money. So I'm putting that blame on Susan Hayes, because I'm going to ask for money. Our one budget request for the coming year is an additional $50,000 to our medical examiner budget line item. The last couple of years, we've seen an increase in deaths statewide. Last year, the deaths increased by 18%. That's nationally, I'm sorry, according to the CDC. Statewide, deaths increased 16%. Along with those increases in deaths means there's more medical examiner cases. Last year, we saw a 17% increase in the number of cases that were going to either the local medical examiner or to the state medical examiner. Right now, our current budget is $140,000 a year to cover those costs for the MEs. It's not enough. Just to give you what we've spent the last 3 years, in fiscal year 2019, we spent about $94,000 to cover ME costs. We had foresight enough to carry a little bit of money forward into the next fiscal year to pad our $140,000 budget, so we had $165,000. So in fiscal year 20, we spent $144,000 for ME costs. This year to date, as of today, we have spent $130,000 in ME costs, and that doesn't count any invoices that will come in for May or June or any that may straggle in from prior time in the year. So that being said, we need the additional $50,000 to be able to pay the medical examiner costs. That's my request. Again, I appreciate the opportunity to speak to you all. I'm happy to answer any questions that you may have.
I'll ask you the same question I asked Tracy. Medicaid Transformation, Health Department, and the...
You know, we don't know exactly how it will impact us. We don't think it will impact us a whole lot because we don't do primary care. Family planning is carved out. Our dental program is carved out, so we think it'll have very little impact on us.
Thank you very much.
Welcome. Thank you.
Good. Thank you. Public Works, Axton.
Good evening. Public Works budget is not changing very much this year. On the revenue side, I did make some adjustments to better track the state tax funds that we receive. On the expense side, we have seen some increased operating costs with the opening of the Trinity and Randolph convenience sites. So I did add a couple $1,000s to cover those increased expenses. Other than that, my budget's pretty much the same as last year. So I'll be glad to answer any questions, or if you have any questions about any of the projects that we have underway.
And those changes are just benefits and insurance? Those changes are just benefits and insurance?
Changes are like the telephones. We now have 2 more telephones at 2 more sites. We also have just maintenance costs at the sites. So.
Okay, any other questions? Thank you, Paxton.
All right, thank you.
Soil and Water?
How are y'all?
Good evening.
I told Michael, I said, I feel like I need to bring like a covered dish to have like a little party or something because I miss everybody anyway. But we are happy with our budget, same as last year. We are looking for possibly asking you guys for a truck next year because ours is kind of a little sad. Other than that, this year, we're in the clear. If you have any questions, we're good. And Craig couldn't be here. He apologizes. He had a water tank issue or something. I don't know. But short and sweet. Any questions?
Thank you very
All
much.
right, thank you.
Thank you.
Give Craig our best.
Oh, my goodness. We got lucky.
Cooperative Extension, Kenny Sharon. Good evening, Kenny.
Good evening, Chairman Fry and the Commissioners. Ben, attorney, you didn't get recognized much. Will, glad to be here. Our budget, Dana and Sarah too, I forgot. Glad to be here. Our budget's not changing that much this year. And we are getting back into more proactive planning. You know, extension is really two parts. We react to inquiries and questions about disease and crops and animals and what can I do to my lawn. And we were still continuing to take that type of information in during the pandemic. But now we're returning to more proactive planning and educational type activities. We're doing a lot of that virtually, but we're starting to do that more in person. So I'm looking forward to going forward in the coming year as we get to be more proactive in planning. We have some fantastic agents doing some great programming. I think Sam over at the county building is really enjoying our new horticulture agent. They're doing some great projects there in the county with the county building and putting in a pollinator bed and just do some good things that help with wellness. And so anyway, we're up and going and running. One of the cool things I'll bring before you that's neat, I've gotten a second round of grant money for the Band NC project. With that money, I'm proposing to add a digital ambassador. That first round of grant funding, we created a Randolph County Digital Alliance. We worked together to put together a digital inclusion plan for the county. The second round, I proposed to hire an ambassador to go out and promote that plan, work with that. So we're recruiting, just put in the paperwork today about recruiting a position for a temporary part-time person to go out and talk to folks in the community about their digital needs and broadband needs in the county. So that's coming. That's sort of the work I do as the director. I do some community development work along with the administrative work. So anyway, glad to be here. I do want to mention the proposed budget that was given. We do have an old 1997 pickup truck. I think it was Paxton's way back when. You remember that truck, Paxton? Anyway, it's kind of on its last leg. It's not as important as the ambulance, but I just wanted to bring it before you because you never will get anything unless you ask for it. So anyway, that's not in the budget, but it's something we proposed. And if there is any money left over anywhere, I'd appreciate something that we could use mainly to pull the trailer with. And then if we get an SUV, we could use it to haul some people around too. So anyway, just want to bring that up. Thank you so much for your support. Yes.
Okay, so there was a survey
Right.
about broadband
Right.
on the website. So do you have any results for that for Randolph County?
Right. Once I advertise that, we've got a tick up in the number of people that have taken the survey. Taking the survey down the road, there's a lot of federal money, a lot of money going into broadband infrastructure. One of the things I want this ambassador to do is get more people to take this survey because better data leads to better funding choices. So right now, last time I checked, we had about 131 people in the county that had entered information into that survey. I want to blow that out of the water with this ambassador. I want this person to go out there, help people take the survey, help people to get them to take the survey, because we need to know where the broadband speeds are in the county so we can get the funding in the right places to put the wires in the ground or to fix broadband out there when the money comes available. So
And we need to be aware of that.
Right.
Because that is a big, that's a big concern for the NCACC. It has been in the past, it continues to be. And so we need to know what the broadband needs are in Randolph County.
Yes. Well,
So if you can work with us on that.
absolutely. Be glad to.
There's a lot of awareness for broadband.
Yeah, it
I
is.
think there's going to be some significant dollars available.
Right.
It's
right.
been our number one goal for about 3 years in a row now.
Right.
And
In the legislature.
I don't know how to determine the cost of that.
Right.
And that's one of the things we're wrestling with is do we contract with somebody and then they tell us how much or,
Right.
but that's be a great help for us to identify
Yeah.
the spots. Some of the stimulus money we just got is for broadband. And
Right.
I think the state budget's got some more broadband
Right.
in it, too.
Right. Yeah, I'll be glad that we had a great group of stakeholders working on this digital inclusion plan. That's Ross Holt's part of that, actually. And so we'd be glad to provide any information and help and anything that you'd like to do. Sit down and pick our brains about it, and we'll get it together.
Great.
So, all right. Thank you.
I have one question,
Yes.
and only one. Is there anything out there, grant-wise or anything, that can come through your agency about dealing with fire ants?
We had a great webinar about that a few weeks ago. But yeah, our agents put together a webinar and some ways to combat that. So there are, I don't know if there's a grant for a county-wide thing, but we might could help you in your yard. So
I was hoping we could get a warden or something.
they are pesky little dudes, I tell you what, and they hurt.
Yes.
So
It just takes a little money out of your back pocket's all it takes.
but if you need some advice on what to apply, give us a call at the office. We'll hook you up. So thank you.
I got some tomato questions, but we'll save them for later.
Okay.
I'll come by.
I'm going to talk to Annie.
I'm sure they're getting a lot of them
No, well, I'll go by, just
right
about
about
tomato.
now.
All right. Okay, planning and zoning, Jay Dale. Okay. Jay must
He's happy.
very happy.
We cut his budget then?
Juvenile day reporting. Pam?
Just don't give him anything, but that's what we'll do.
Good evening, everyone.
Good evening.
Evening.
I want to start out by thanking you all for the support that you've given me and my team in what we do. It's been a tough year, my first year being a director. It was interesting, to say the least, but we made it through. I have some of my team here tonight that I just want to recognize, and I want to thank them for all their hard work, their support. They are Juvenile Day Reporting Center. They are the ones that are working with some of the most vulnerable population that we have in our county, so I just want to thank them. Thanks, guys. Last year I came before you guys and I talked about a substance abuse case manager position, and I requested for you guys to approve that, and I'm so thankful that you guys did. You guys all know that Randolph County has been hit hard with the opioid epidemic, and it continues to do so. In 2020, last year alone, 576 overdoses were just reported, with the highest number of those overdoses having to be within the 30-year-old range. This year, we're already at 175 overdoses, and that number continues to rise, and that range of overdoses is dropping below 30. I share these numbers with you because I want to show you that there's a trend that the overdoses are creeping closer and closer to our youth. And with our substance abuse case manager position, this past year we've actually been able to obtain our license with the North Carolina Department of Health and Human Services, and we are now certified to do treatment in the form of counseling, one-on-one counseling, family counseling, and group counseling, along with conducting substance abuse assessments, and continue to do our substance abuse education course for our youth, and a portion of that is also for our parents. The case manager that is over that, she's a licensed clinician, and she comes to us and does this work. She's in our office 40 hours a week, and she meets parents where they need to be met, whether it's in the office, in the community, and at the time that they need to be met as well. This budget year, I'm also going to be requesting for an additional position to cover the cost of the position itself and training materials needed for a program that I want to implement here in our community. And that position is for a case manager in the form of a mentor advocate. I recognize that there's limited funding this year due to COVID and unforeseen circumstances, and I appreciate just the opportunity to come up here and speak with you about this position. I'm grateful that you guys continue to recognize the importance and the need of our community, and also to help reach our strategic plan in the county of providing prevention services to the youth in our community. As part of the county's strategic plan of preventing juvenile justice involvement, increasing graduation rates, and improving social skills, this position will help the Juvenile Day Reporting Center tackle that goal. Youth mentoring has been proven in multiple studies across the nation that having a consistent pro-social relationship with a mentor can help with the support of the positive development of that youth. Multiple studies have shown that mentoring youth improve the youth's self-esteem, academic achievements, and peer relationships, which will lead to reduced drug use, aggression, depression, and delinquent acts. Our mentor will build a network of volunteers to work with our youth daily and weekly and will help curb the need of court involvement with our youth. I've been engaged with multiple community members. I sit on multiple boards throughout our community, and I've spoken at many community events where I've heard from community members themselves, parents, youth, and other agencies, and everyone's kind of requesting the same thing, and that's for a positive person to be involved with our youth in the form of some sort of mentoring. I've spoken to many community members and partners and other agencies, and everybody wants to be involved in the mentoring program. They're very supportive with the idea, and that's all I'm requesting. If anybody has any questions, I'd be happy to answer them.
We have the handouts, that's a little different from what has been in the original budget. So that is the mentor advocate that you're referring to?
Yes.
Which is the addition that you gave to us, right? Talking about that. And I know we had spoken about it and you already said it, so I mean, there's no, I was going to ask, but you know, you've spent a lot of time, like you said, in the community talking about and with all the steps in your process and all the folks you deal with of what's really needed. And you already mentioned that, but the mentoring just rises to the top of the...
Yes, mentoring rises to the top of it. It is something that a lot of people in the community, the citizens themselves, says that they need something positive for our youth to be engaged in. So what I'm requesting is a position that will be a mentor advocate that will really take the role of developing the program, working through the program, and also gaining all of the volunteers.
Yeah, and I guess in talking with you, which I already know some of this, is, you know, it sounds like you already have a line of volunteers lined up at the door if we could put this program in place.
Yes, I do.
They're willing, more than eager and willing to jump on board.
Yes, sir.
Which is exciting to hear. But it's a good community.
It is.
Agree.
All right, thank you.
Thank you.
Thank you, Pam.
Good to see y'all.
Good evening, Commissioners Howe and Chairman Fry. I'm Julie Alston, the Director of the Adult Day Reporting Center. As you know, everybody, both personally and professionally, has been impacted by COVID. And it is all of our departments' responsibility to ensure that we meet the needs of the citizens that we serve. Part of our responsibility at the Adult Day Reporting Center is to determine what services are most needed by the population we serve. And those are adults who are involved in the criminal justice system. The Randolph County Strategic Plan seeks to address public health goals in a number of ways. That first goal is to improve access to health and wellness within Randolph County by reducing barriers. And I don't have to tell you how many barriers there have been specifically over this last year that have been highlighted by COVID. That barrier for us, bar none, is transportation. It's either a lack of transportation or inconsistent transportation. And one of the highlights of our program is that we offer that to our clients who live in Randolph County at no cost to them. And it's a huge part of what makes or helps them be successful. Our oldest vehicle currently is 18 years old. The newest is 13 years old. Each of these vehicles, and we have 4, are 200,000 miles plus. You know, we've gotten the good out of them, so to speak, but our expenses for fuel, repairs, and regular maintenance over the last year have been mitigated by the pandemic. So we haven't had to spend money on those things, really. However, we are looking at resuming in-person classes and services, and we are requesting 2 new Chrysler Voyager vans, both of which can transport up to 7 clients. This would give us the ability to allow for social distancing while maximizing the amount of clients that we can transport. The focus here is that this would be more reliable and safer for our clients. And we just hope that you would consider these vehicles for us. This is a huge service that we offer to our clients, and for many of them, it's the only transportation they may have. So I appreciate your time this evening, and if there's any questions I can answer, I'll be happy to.
Okay, any questions?
Okay.
Very good.
All right, thank you so much.
Thank you very much, Julie. David Bryant, Building Inspections.
Good evening, Commissioners.
Good evening.
The Inspections Department has requested a new position for this upcoming budget, and I think Will and Hal has pushed it through for your consideration. This position will be for helping to further the e-permits thing. We had such a success with that program. We've probably got 500 contractors signed up now, and probably have issued 1,200 permits online. So that's really been helpful. And this new position will kind of oversee that and also take care of some condemnations and complaints. And touching on what Tracy said on her investigations, we get called in from Child Services. We have to go inspect houses. I got 2 I'm doing from Guilford County Child Services in Randolph County this week. So to give you some idea, it just kind of, it's hard to keep up. So this new position will definitely take some stress off of the inspections department. During COVID, we hadn't really slowed down any, and now the cost of building materials have about tripled. But they're still building, and it doesn't look like it's going to slow up, which I'm grateful for. But it's just hard to keep up.
Doing inspections on all those houses going up in Trinity?
Yeah, we are. I mean, that's the fastest growing area, Archdale, Trinity.
There's about 1,200 right now.
Yeah, and I mean, we've got some in Randleman. It just developed a 30-house subdivision, and they're just everywhere. So, I mean, they're selling them before they get the footings poured. Yeah. But I'll be glad to answer any questions. But the inspections department just keep up and keep this online system going to get cities involved and the library. I just need some extended power to make all that happen.
How many, I know you've asked for this, asked for a position for several years, so.
Yeah, I kept changing the way we do things to kind of keep up, but I'm running out of ideas on how to do that.
It's just sheer volume right now.
Yeah, it's just sheer volume. But, the permitting program, the online part, anyway, we put the responsibility back on the contractors. They actually had to do all the data entry. So that took all that off of us. We just process, the permit, and then they pay, they print their own stuff out. So that's really helped. But now we don't have it open to the general public. It's only to the contractors. But I want to expand that to, the citizens as well, which would take additional workload off of planning and zoning, permit techs, and then our staff as well.
Okay.
I have to say, I'm getting a new neighbor, and they have been very complimentary about the permitting process in Randolph County.
Well, it's easier to make friends than enemies, and
Well, they're coming from Charlotte, if that tells you.
I won't hold that against them. But anyway, we try to bend over backwards for people because it's all about getting to a certain point and making things happen. So
He's been very, very complimentary.
I'm glad to hear it.
Thank you.
You have any other questions?
Any other questions? David?
Thank you, I know you've been busy.
Thank you.
All right.
Yes, sir.
Thank you.
Unbelievable. Okay, Donovan Davis?
Good evening.
Good evening.
I miss seeing everybody on our Monday morning Zoom meetings, so it's good to be back in person. I handed you a 30-page document we'll go through word for word. So if y'all want to take a break. Now, what I gave you this year is an annual report. Each of our divisions went through and highlighted what they've been doing especially this past year with COVID. But page 24 is the important page, and that's our additional request. But I do want to go through, just give you an idea of what's in this document. If you look there on page 2, it's got each of our divisions and tells you what they've got going on, their call volume, where we are, where we've been in the past. Tara mentioned the medical examiners. I've got a whole page on the morgue. Commissioner Allen will appreciate that. But it explains that just for medical examiner calls, there's at least 5 departments involved, and that's my department, Sheriff's Department, Public Health, DSS, and Register of Deeds. DSS comes into play if the body's unclaimed, and we have about 20% of those each year. So that explains that, how it gets paid and why it's paid and all those things. But if you go through at your leisure, the thing that I want to focus on this year is staffing. In our 911 center, our call volume has continued to increase year after year, and we did add some staff in 2018, but none since then. And with the 911 center staff, you know, they work very hard for 12 straight hours with no lunch break. They eat lunch there in the room, and they are able to get up and take small breaks here and there. But the call volume, not only the 911 phones, but the radio volume. So whatever law enforcement, fire, or EMS are doing out in the field, they document everything. They have to look ahead and do resource management. Their job is critical in the county. Now, we all sit up here and justify who gets what positions and all. It's very difficult, not only the jobs you have to make those decisions, but the 911 center is critical. And basically, if you want somebody to answer the phone in a timely fashion, we're going to have to add staff. We had a call just as I was coming over here, Dixie Drive at the Cloverleaf. One accident, they had 19 calls. Well, there's only 7 of them in there. So we've got to increase the staff per shifts in there. So our requests for that, if you look on page 24, it's all my requests with check marks for your convenience. But if you look at the top, staffing, as I mentioned, not only in the 911 center, but in the department in general. Our call volume with the pandemic, all of our expectations, just things coming down from Raleigh that we're required to do now, it's just more and more and more. And so in the 911 center, those are my top priority positions, which is 8. And that is 4 to start in July and 4 to start in January for a total of just over $300,000 in salary. That includes benefits. The next 3 down positions, it's hard to prioritize because they are equally important in those areas. If you look at the fire plans examiner position, all of our fire inspectors, we only have 5 in that division. They're out constantly doing inspections. Every church, business, and school gets inspected annually. So we don't have anyone that really sits down and dedicates time to look at the plans and to be able to review them. As David was mentioning, you know, all the things that are involved in permitting, fire is one of those elements. So we've asked for a fire plans examiner. In technology, in the 911 center especially, the next gen, I've mentioned before, but you may not know about it or remember, videos and photos are going to be options that 911 callers will have in the very near future. Unfortunately, there's systems to manage that have to have constant maintenance and everything else, just like our computer-aided dispatch and all these other elements. So we really need to add a person in the technology area of our department to manage those things that are coming. We already get texts. And if you look on the 911 page, you'll see on the appendix in the back, you can see how many text calls we actually get a month to 911 or over the year. The next position is in the emergency management. This position especially has had a lot of additional expectations from the state for planning and everything through the pandemic and for emergency operations plan. There's only 2 in that small division, and they have managed the emergency operations center that many of you came through this past year when public health was in there. Last 2 positions aren't a priority, but would be helpful. Housekeeper, we have re-signed a contract for a cleaning service. Robert's done that for us, so we won't necessarily need that over this next year, but it is something we would like to have to help us maintain that building that we were so lucky to get. Those are the positions. Another thing that I want to mention is our paramedics. We're having a hard time recruiting paramedics. It's not just here, but we're having a lot of paramedics that are leaving. And it's some driven by the pandemic. They don't want to be involved in medical anymore. Some have left for totally different careers. Some have gotten their nursing degree and moved on to hospitals. Some have moved to other counties, but we're getting kind of thin right now, and recruitment is a difficult thing, not only for us, but other counties. And other counties are starting to have to shut down trucks. We've only had to do that once and that was about about 3 weeks ago. We had so many call-in sick that we had to shut a truck down for a few hours, for a 12-hour shift. But recruitment and retention in that area is almost at a critical level. As I mentioned, surrounding counties are also starting to have to shut down some of their ambulances for the same reasons. Unfortunately, the community colleges have had limited schedules through the pandemic over the past year, so their paramedic programs are not producing like they have in the past. Randolph Community College, they're great to work with. They've got a program that we're hoping to kick off with at least 14 in a paramedic class in August. But these folks have to work full-time while they're trying to obtain those certifications. Longevity, I think, is something that the younger folks that come in and work today look at the here and now and aren't thinking as much about retirement in 30 years. And we try to stress to them, look at the benefit of working for a local government or any government, because you can retire at an earlier age if you stick it out. But they're, again, seem to be more focused on the here and now is how much money I'm making. So I think that's something we're going to have to look at very closely in the very near future. The capital outlay request there are 2 ambulances included in the budget like almost every year. Well, every year. We're kind of in between right now where we're moving out of the Chevys into the Fords, and we could use 2 additional ambulances, but it's not critical. It will be probably next year. We just kind of have this gap that's going to come up about every 6 or 7 years where we need to add a couple of extra in there. But the rest of the capital outlay requests are replacement vehicles. You're aware of the Viper Tower and those types of things, and I know there's other possibilities for those in the future that we can talk about. And then the non-capital requests are just line item increase requests for stab vest and protection jumpsuits we need to replace for our paramedics. But again, staffing is the critical need. But if you have any questions, feel free to call me. I've included a page with all of our command staff on there, so if you can never find me, you can always find one of them. And then you can see all that data. So if you have any questions about any of that, you're always welcome to give me a call, or if there's any questions I can answer right now.
Pretty detailed.
I know Commissioner Kidd is very, very interested in the morgue.
Yeah.
And
Between him and Commissioner Allen,
I
yeah.
didn't see any request too much for.
Yeah, there's a whole page on it. Yeah.
It's always advertising.
That's the one thing I don't have to deal with is the actual money of it. It's just the people. That's right.
I've asked everybody else. I asked you. Medicaid.
Yeah, and I'll have the same answer. I don't know how Medicaid transformation is going to affect us, but it is going to be probably a nightmare because the people we deal with now, when they call in 911 and need ambulance transportation that's non-emergent, all we have to do is get a physician form that says, yeah, they're non-ambulatory or they're not capable of riding in a normal vehicle. It's going to affect, I think, our franchised agencies more, Ashland and Piedmont Triad, because they handle most of those convalescents. Now, Medicaid patients are going to have to call this 800 number and make the appointment through them. We don't still have to sign the contracts by July 1st. We don't know how they're going to contact us and let us know that there's a transport, or how they're going to know that these ambulances are already on calls. It's just, I think it's going to be a little bit of a nightmare in the beginning at least. But as far as the revenue or any types of effect, that we just don't know. And I think the pandemic's put a hard time on it over the last year. They've not really been able to communicate.
The transportation end of it was something that was discussed, it's been discussed a lot.
A lot, yeah, because
It's kinda neat.
there's a broker, we have 11 contracts that they want us to sign, and we're going through them. But golly geez, it's, insurance contracts, they're not easy to read. And we do have a meeting set up this week, or next week, I'm sorry, when Amy gets back from vacation with the 2 franchise agencies, because we have to make sure all of our contracts are the same because of the franchised fee schedule. So we have to make sure we're all putting the same thing in there.
Thank you.
Any other questions?
Other questions? Very good.
Thank you.
Thank you, Donovan. Animal Services, Jonathan Moody.
Hello, everyone.
Good evening.
Okay. Nothing's going to change on ours. We're happy with what we got last year. We're going to keep it the same. I think the only thing we're looking for is maybe a new animal cruelty vehicle. It's going to be for me. I'm going to take my truck, which is a 2018, put it in to the fleet for one of our older trucks. I think it's got almost 250,000 miles. We'll take it out and then put my truck in on the fleet. Also, we're going to be doing a rabies clinic, going around from house to house, giving rabies vaccines to animals of people that can't bring them to the shelters or to the vets or anything like that. And I'll need something that's enclosed in order to put the medication and stuff in so it doesn't get hot.
Have we had some rabies cases, Jonathan? More than usual, or?
Not more than usual. I mean, we've had a couple. We had a spree there for about 2 months where we had 3 foxes up towards the Archdale area that tested positive.
All right. Any other questions?
Just curiosity, are foxes more, I know they're supposed to be carrying rabies and things, or ability to. Are you seeing those kind of cases rising?
Not really. I mean, we had maybe 3 or 4 last year, so we've had 3 already this year, so I don't really see anything changing on that.
The reason I ask is because I go for years and never seen anything. Now I've seen 2 foxes.
Well, you gotta think about too all the construction that's going on. With construction, you're tearing up where they're staying, where they're sleeping, where they're doing their thing and everything, and so that's why they're moving around more. Yeah. You're disturbing where their habitat.
Down in your yard.
Yeah, it's mostly my yard. It's mostly house cats. It's a problem.
Yeah.
House cats are a problem. But seriously, they're going through my yard.
Rabbit foxes.
And that's little, it's a little unusual.
Well, if you need a trap, we'll help you out.
We need to crack down in the farmer area.
That's right.
Right. Any
Y'all
questions?
how's the employment doing? How are y'all doing hiring people or staffing wise? Is that?
Well, we're actually really short-staffed right now. As far as the animal control side, it's actually me and then another animal control officer. That's actually all I have right now.
Well, like everybody else, we've got it published. We're out there, so.
Oh, yeah. We're in the process of hiring, I think, 3 more. I should have 2 that'll start on the 16th and 1 that'll start on the 1st.
Okay. Any other questions? All right.
All right, thank y'all.
Jonathan. Okay, Sheriff Cid Vehicles.
Can you send some out there to shoot these foxes?
Mr. Chairman, other commissioners, we agree with what the budget shows, except for the capital outlay. We're in desperate need of vehicles. We purchased the vehicles last year. 2021 budget was decreased and delayed until September of last year, and we're still waiting 12 vehicles due to the late order. There's
When
7.
did you say you placed that order?
We had to make the order in September of last year.
And you're still waiting on those vehicles?
We have received, you know, a couple of the Vice cars that we ordered, but we're still waiting the Chargers and 3 Durangos, 2 Chevy Tahoes, and right now we have nothing. We have no backup vehicles that are equipped to put a computer in and outfit a deputy the way he needs to be outfitted for mapping, computer purposes, and it's definitely a safety issue.
Sheriff, if those are approved in this budget,
Yes, sir, last year.
When would you expect to take possession of those?
Well, we hope anytime. They do the orders according to when we order them. And, you know, Chevrolet, Dodge, they're all behind. So we'd have to check with them and see as far as the Dodge Chargers. We haven't heard anything or have not received any of those patrol vehicles yet.
They don't have any sitting around on the lot up there in High Point like they used to have.
And, you know, I know a lot of it has probably to do with the COVID, with, you know, everything stopping for a year. But it's hurting us big time. And,
I mean, it is the same problem that dealerships are having. I mean, you can't find a new car.
Yeah.
Chips and all that whole story.
Crescent Ford and High Point, ran through there this morning. I bet you there's not 10 cars on there to be sold, 10 vehicles at the moment.
yes, sir. But additionally, Sheriff's Office currently has 1 unmarked backup vehicle available, 2014 Crown Victoria with 107,000 miles. And the capital outlay, our original request included 31 new vehicles to replace roughly 13% of our fleet. However, in light of the proposal limited funding of capital outlay projects, we propose replacing only 8.5% of our fleet to replace vehicles that are in excess of 130,000 miles and 150,000 miles. And we do have, you know, not to consider the ones that may be wrecked and not worth fixing. We'd like to purchase 20 new vehicles, slightly higher than the number of vehicles that were budgeted for in the 2021 budget. We also respectfully request that the funds be allocated in July so that the orders can be placed as soon as possible to help with the ordering and getting the vehicles in a timely fashion. We want to thank you for your consideration in all these requests and for your service to Randolph County. I realize that you must make budget decisions for every department while considering the potential revenue during these uncertain times. I assure you, I am doing my part to make those decisions less burdensome and to generate additional revenue where possible. My command staff and I are committed to seeking ways to provide ways of saving money and being good stewards of the taxpayers' money. You know, after hearing the 1,200 new houses being built, I feel like we need to be asking for men. Right now, we're one of the few sheriff's offices around this area that are not 20 to 25 men short in their office. So we are very fortunate there. We do have some openings that we're trying to fill, and we've had a lot of good people from other agencies throughout the state move here and apply for those jobs. But any consideration with
all those houses and expansion in Trinity, the city council, though, opted not to expand patrols up there, right?
We're going to have to do something. That's all that is going to increase the population and the number of calls. You're going to see Donovan's section need more help there. We're going to need more help. and it's just going to be a nightmare if we're behind. If we plan it and get additional men, you know, before it happens, may help out some.
I was saying, you've heard others make presentations tonight about their vehicles. One mentioned one a while ago, is 24 years old.
Yeah, and I may talk to Kenny Sharon about his 1997 Chevrolet truck. I'd like to put a bid on it.
The board is sensitive to that. The county commissioners are, and it is an area that we're taking a look at. And with our current revenue picture, we have a little bit of wiggle room in our capital projects list. So we're aware of that, not only for you, but some of these other departments have the same kind of issues.
Yes, sir, I understand that, and we will accept whatever's sent our way.
Thanks, Sheriff.
So,
Rue?
hey, have you got a presentation on top of this?
Well, I was just going to add something
about capital?
Not really, just.
Okay. Well, I was just going to say, just kind of, I mean, it's a public meeting, so just for everybody and everything, and looking at the vehicle requests and everything, can you explain, which everybody probably knows but me, but I'm not in law enforcement. So, well, I mean, it's easy to look at, you know, the patrol vehicles. That's really obvious. I mean, it's the Chargers. You got, you know, blue line on top of them. Can you, like, there's some CID vehicles. Just tell everybody what that is.
Well, criminal investigations, you know, they go out and do cases, and these vehicles are your older vehicles in the fleet. They're not used much on patrol, but they can be. These are your older vehicles that we have handed down to detectives that go out and collect evidence, basically.
But they're vehicles that are out on the street with law enforcement.
They're your older, more mileage on those vehicles.
You would look at salvaging them out, the ones you're using now?
Yes, sir.
Right.
Some of those are on their last leg.
Hey,
I mean, kind of switching something, but still. I just wanted to point out that, you know, they're out in the field. You know, you're
Yes,
not
sir.
buying vehicles to drive around in. You know, these are out. People see these things, and it might not be the guy that's chasing them down, but they're going to houses, working on break-ins, working on robberies, working on stealing. But because I had talked to Brubaker about it a little bit, and he was trying to explain, you know, we use these. You know, we need these. So I was just
desperately
clarifying.
And I know, listening to the other entities of government, they need, you know, vehicles too.
Yeah.
But I would like to add that our vehicles travel in excess of the posted speed limit, and majority of the times, and they need to be safe and dependable. If that changes any
If
mind.
you got a truck or an SUV, you can give to
You gotta
Kenny,
go,
Joe,
you
talk
gotta
about
go.
Yeah, take it.
Work a deal between some departments here, just rotate around.
Put a governor on Kenny's vehicle.
We could try. Any other questions?
So, Brew, do you have something to?
Yeah, I wanted to add one thing for the sheriff. We were looking over our undercover funds that we use, and I think Will and I had briefly talked about it as far as what we've been doing for the 13 and a half years that I've been here. It's all been funded through county taxpayer dollars. The sheriff had agreed that it would be fine as far as to increase the funding for it. It's been at $25,000 for the longest period of time, and we wanted to increase it, but didn't feel right to do that as far as taking that from taxpayer dollars. So he's vouched to use restricted funds to fund that here going forward. So in other words, we currently had $25,000 allotted, and we want to increase that to $50,000. The entirety of that amount would be restricted funds. That's the only other change.
Will we have funds available to do, I don't know the current status of those restricted funds.
Yeah, there's several hundred thousand as of June 30th of 2000, right?
Mm-hmm. Yeah, as far as our expenditures that we have left, I tried to calculate everything today. We're right at 96,000, give or take. That's what we've asked for to spend within this budget year. It might not all be spent, you know, numbers change, that kind of thing. But we have enough funding to take care of that for this upcoming fiscal year.
Well, and those are not a part of your regular budget, so we take those up as you bring them to us, so.
Correct.
Right. Good. Any other questions?
That's over and above the budget.
Yes, yes. How about the detention center, Sheriff? I noticed there wasn't any positions in here for that, so I think that staffing's coming along.
We all agreed that before it opens, before we need the additional manpower, we can hold off a year to help alleviate some of the pain on the budget. Hopefully, we'll have the number of applicants interested to apply when that time comes. We have got, I don't know, maybe 10 prospective applicants ready and waiting right now, but we still have some positions to fill. So we're going to pick the best of those.
Good. Are you like everybody else? You can't find people?
It's,
Or are you getting an adequate supply of applicants?
We're blessed thus far, but you know, with the sentiment nationwide on law enforcement, there's not a lot of people, not a lot of good applicants, you know, filling out that application and wanting to go into basic law enforcement. You know, the money's low. You know, what's happening, lawsuits, the way that law enforcement has been treated in the past year. But I do hope that we see a 180 in that in the next couple of years, where law enforcement's looked up in a positive way, and it's an admirable job and profession.
Well, I hope they sense that from Randolph County, that we're not defunding our law enforcement.
No, we're very blessed
out to
here.
catch the
And that's one of the reasons I feel like we're not shorthanded. You know, we have people coming from Davidson, Guilford, even taking pay cuts just to work here. So it sends a message. I think we're doing the right things, and the support we have here is what people are looking for.
Well, one reason I asked that is because of seeing a, excuse me, a report on one of the news networks about Asheville, I think.
Oh, yeah,
They're cutting back what they're doing.
On calls, not going to certain calls. And, you know, that's very dangerous because those minor calls can develop into something very serious very quickly.
You go up there, that's the one place that doesn't need to defund law enforcement.
Yeah. Think about it when you vacation.
They're laying in doorways. I mean, somebody says East Coast, San Francisco.
Yeah.
But are you finding that kind of fallout helps us? Is that kind of?
Yes, sir.
Overall?
Yes, sir, it does. It helps us a lot.
Yeah.
And there's where you find that, you're going to see a lot of good officers retiring early or relocating to another agency.
Gotcha. All right. Any other comments, questions? Thank you, Sheriff. Thank you, Brew. Public buildings, Robert?
Mr. Chairman, Commissioners, I'm happy with my budget. I just would like to kindly justify the positions I asked for. I know they got cut, and I've talked with Will, I understand. But in saying that, I'd just like to let you know that these added EMS bases that are spread out all over the county, if we get a small call there, you might as well count a half a day of a team going out there. Same thing with a lot of convenience sites. You know, we take care of all those too. And you can look at, just say Dollar General, we'll be moving in there pretty soon.
Yeah.
As soon as that's done. Well, that building has been taken care of with one HVAC unit. And I think when we're done, it's going to be 4 or 5.
4 units. And as the new regulations, you have to bring in outside air to the buildings. So you have to oversize the units to take up for that. But, I mean, we're everywhere. We're just all over the place. With this COVID thing, when a building would have a suspected case, we'd go in. Yeah. And I couldn't tell you how many times we had to go in and sanitize the courthouse and just almost all the buildings. I got a really good team. I asked for 2 worker positions. If we don't get them this year, I would really like you to think about it for next year because we're just growing so much. I'm honest with you, I don't look forward to hiring somebody because in this line of work, you can't hardly find anybody to work anymore. I mean, it's very difficult. But that's all I wanted to say, and I want to thank Will and Hal because they work with me. Anything I need, usually we work it out somehow. And thank y'all for your support. We've been able to add equipment in the past that's really helped us out a lot. Some overtime things they've worked with me on that's helped a lot with comp time, so I don't have to let people off.
When the sheriff goes into that expanded area up at Northgate, we'll still be responsible for those buildings.
Yeah, because we'll have him and child support in there. Yep, and that's one of the ones that's, and the Roses, you know, it's been moved into the old Roses building, and it's full now. It's full up. And I think Rent-A-Center will be leaving in the next year or so, so we'll be putting somebody in there, and which we take care of it now on the outside, but we don't go in inside much. Yeah. All the libraries, you know, well, not all of them, but we work in the libraries too.
I was trying to look back at some history, and you know, we got this new computer, so I'm working on it. But anyway, I mean, when's the last time we had a big staff increase?
In our department?
Yeah.
When James was here, I think before he left, he put in for 2.
So, and I was I was pretty close on that. So I was kind of thinking about that is how many square feet have we added to you with convenience sites, you know, ambulance bases, and all the other properties like Northgate?
EMS HQ is a big building too. I mean, that added a lot, and it's got a lot of technical HVAC stuff in it.
And if I was just looking at, you know, square footage per person, if you will, which may not be a fair factor, and I looked like the increased square footage today versus that, I mean, it's not.
We're around 700,000 just in building space. Now, that doesn't count parking lots and all the surrounding stuff. And all the other stuff we do. I mean, we're always moving people. IT, we just went in and built a bunch of offices, kind of COVID related, so they could come back to work and separate. We're fixing to do something like that. The health department's starting next week.
Even with the COVID dying down, and I know you cleaned a lot of buildings, is just looking at the square footage. I mean, I'd love to try to figure out something because, like I said, if I just divide it by man per square foot, it's way. I mean, I figured you'd be asking for 8 people.
If you look at the standard, we're way behind. But, you know, we do what we do, and we'll continue to do that. No matter what, we will drive on.
And they're getting more spread out too.
Yeah, that's a big factor when you go.
Up in Archdale.
You go to Trinity, to Erect, and New Hope. I mean, that's a big hump.
And have you got a truck you're not using that Kenny can borrow?
I got an old Dodge on me. Well, David's got one of mine at inspections. We'll send it over to him when it gets done.
Everybody will just switch around.
Yeah, but that's all it is. But I appreciate all your support and everything that's done for us.
Thank you, Dave.
Anything?
What do you do for fire ant control?
Oh, man. I got heat up with them the other day. Actually, we just go sprinkle this powder over.
Take a big stick and go in there and
push it in there,
and then walk on it.
Oh, yeah.
That's maybe what somebody done. We're having rain. They did the rain dance.
All right. Thank you,
Any other
David.
questions? Thank you.
Thank you. Register of Deeds, Crystal Lowe.
Good evening, Chairman Fry, Commissioners, and members of the board. I have no special request. I have no problem with the budget. Thank you for all your support.
We have a bunch of questions.
Busy too, aren't you?
I've been very busy.
Yeah,
Yes, COVID, and this year has been very busy. You can ask Ben Morgan.
Yep.
He comes in, land transfers are booming, and last year everything in our office was up, all the volume was up. I hope you can tell that by the reports I send you every month.
You
We're
do
doing
send a
very
report
well
every
in the
month.
office.
Thank you.
I
You're
had to
welcome.
see registered deed services so I could go get my permanent driver's license.
There you go.
Long-term thing?
Yeah.
Yeah.
Had to go
We
get-
help in
had
any
to
way
go
we
get
can.
marriage license.
Did y'all have any questions for me?
Well, I know Maxton has a bunch of questions, but I was going to.
I don't know anything about fire ants. I don't know about fire ants or
No.
rabid fox.
All right.
I was going to say, I don't have a question, but I've got a lot of reports over the past year about customer service in your office, which was, so thank you.
You're welcome. Thank you. Thank you all.
I get them from Guilford County, too.
You do?
Folks up
About
in
your
our
office,
corner.
not their office.
Mr. Chairman. About how efficient our folks are down here getting it done, here in the courthouse. I hear it all the time.
Well, thank you. We appreciate that. Thank you
I
very much.
smile and stick my chest out.
Mr. Chairman,
appreciate
just
it.
briefly, I had the opportunity to work in a lot of different registered deeds, and I'm saying something you probably all already know, but we're so lucky in Randolph County. We by far have the best registered deeds that I ever work in. Whenever I go to Guilford County, I just am so thankful that, Krista does a great job and her staff. They're
Thank you
really,
so much.
really on top of it.
I do have a good staff.
Thank you.
you.
You know, Ms. Awful, I spoke at Annie Shaw's funeral, but probably we're approaching 80 years in Randolph County with 3 register of deeds.
Yes, sir.
Don't leave.
I hope I'm here for a while yet. Thank you.
Thank you, Kristen. Okay, Melissa. Elections?
Good evening.
Good
Like
evening.
everyone
Good
said,
evening.
it's good to see you all. As Hal has reminded me a few times, I really can't ask for anything. We have arguably the best facility of any elections office in the state. We have a wonderful staff that works very, very hard. We have a board that gets along. We did have the busiest and most challenging election I've ever been involved with in the fall. Probably most of you probably feel that way as well. We had the highest voter turnout of all time with over 77%. We were fortunate to have quite a bit of grant money this year. We used about $240,000 in federal grant funds to conduct the election in the fall, and then we were lucky enough to get about that much more in grant funding this spring that we have used for new equipment and security measures to make sure that our elections will be secure in the future. So really the only thing, I'm pleased with our budget. I appreciate all the help from administration. We did ask for a small increase to pay our early voting workers a little bit more. We are far behind comparable sized counties in our pay, and we have really dedicated poll workers, but we found out in the fall that we really do need some more recruitment efforts. We try our best, but it's really hard to find people to work for that short period of time. Some of them work 13 hours a day, although it's not many days, it's still long days. And they're very, very dedicated, but they do work very hard. They work probably harder than ever before in the fall. So we did ask for a small increase to give them a little bump up in pay. We just want to start moving towards that. Other than that, if you have any questions, I'm happy to answer them.
We are looking at the pay situation, Melissa.
I appreciate that very much. I appreciate all your support. We were very well supported by the entire county during this past year. I can't tell you how nice it was.
That is a nice facility.
It is. Everyone else in the state is very jealous. But we do use it, and we have a wonderful training facility up there if you need that room for any reason. Now that we can all get back in the same room, it's there.
Great.
I have a question.
Go ahead.
Well, I hate to ask this, but so after the election was over, on into the winter, I guess, if you will, was Board of Elections closed to the public for a while?
Our office doors were closed for a while. That's something that the board decided to do because of the pandemic.
Yeah, I did
But we
figure it
had
was a board
someone,
decision.
pardon me?
I did figure it was a board decision, but go ahead.
Yeah, it was. We did have someone working in the office every day for a period of time, so that we could handle things that came in through the mail. We have a drop box. We answered all phone calls. We took care of all the emails. But yeah, we did, like many other offices, our door was closed for a period of time.
Many other offices in the county?
Mm-hmm.
Oh, okay. All right. Well,
Yeah.
so how many months do you think you were closed?
We were closed from, I think, the end of January through April 1st. Our board continued to meet as well,
Okay, all right.
and all the work continued to be done. I have not heard from one person that they were not served. You don't think you were served?
I think my son went up there when the doors were closed and the building was locked and nobody was there. And there's a number on the door, but
Yeah.
just as a taxpayer service. And I'm not talking to you,
Yeah.
but I will talk to your board. If you could take that message back to them, I'm terribly disappointed that they were closed this brand new, nice, open, large building to the public for 3 or 4 months.
Well,
But it's not-
I understand. I've heard all about it. We were following county policy.
Well, I disagree with that too, but anyway, go ahead. But you can let your board know that.
Well, it would be up to Hal to talk with you about that, I think,
Well,
as far as county
I
policy
think it'd be up
goes.
to your board to try to serve the public better. Because I can look at a lot of other departments here that I could walk in and get service, but I couldn't at your building.
Mhm.
And it's not on you, it's on your board.
You might want to come to one of our board meetings or attend, or,
That's a great idea.
yeah.
Thank you.
Any other questions?
But thank you.
Okay, thanks for your support. Appreciate it.
Okay, Deborah Hill.
Good evening, everyone, and thank you for hearing all of our concerns and considering them. The tax department does have an increase in our operating expense this year, and for one of those reasons is the collection fees for our registered motor vehicles, because we do pay the LPA officers, the offices, and the Department of Revenue for collecting the bills and the postage and printing and mailing those bills. And each year this fee has, the amount that we're paying these agencies has increased, but that's due to the number of vehicles that's being registered, and it's a higher collection rate. So if the higher the collection rate, the more fees they're collecting, so that's a good thing. But it averages out to be about $2.17 per vehicle. So last year we collected taxes on over 156,000 vehicles. So you times that times $2.17, you expect the amount of money. Also this year, there will be an increase in our budget for retirees' health insurance. The tax department, we are a staff of 30 folks. This year, within this last year, I've had 4 to retire and 1 young lady to pass away. So we have lost 5 members out of our 30 staff in this last year. That is taking a toll on our experience, because out of that, we're losing 126 years of service with those 5 employees. And that's one of the reasons that I have asked for a part-time position for a data analysis. This person would help us get through the training of all the new staff. A lot of the training is, you can't get it done in a 30-day time period before somebody leaving, because some of these processes we only do once a year. So we've got to have somebody there on the staff that's familiar to these processes and help train these new folks at the processes. So this is one of the reasons I'm asking for, it's a temporary part-time position, just to help get the new staff trained. But that's about the only thing that has changed with our operating expenses. And if you have any questions, I'll be glad to answer.
Just a question, the people retiring, they've been there for a long time?
That's right. I've had two. One's retiring retired with, she's turned 65 with 21 years. The young lady that passed away had 13 years. I've had one that's retiring with 36 years, one with 22 years, and one of my chief appraisers retired with 30 years.
That's a lot of.
That's a lot for a staff of 30, yes.
In 1 year?
In 1 year.
And we've got reval coming up.
And we got reval. And then that's with what David and the others has talked about, all this new construction, it will have effect on our 4-year reappraisal cycle. And the market is crazy. So it's going to be challenging to see what the true market value is on these properties.
How is your staff, the appraisal staff, how are they doing as far as being able to keep up with all this?
We have
appraisal?
we have filled just recently this spring, it took almost a year to fill those 2 vacant positions. But we have brought on 2 new appraisers at an entry level. But they're divided by divisions, and then they, get their work done, and then they help each other. But it's going to be challenging.
How exactly do you go through the training process with these people? Somebody that's already experienced?
Experienced, and then also the Department of Revenue requires certain educational requirements for county appraisers. So luckily, I was able to pull these 2 new appraisers from contract appraisers, mass appraisal companies. These young men were tired of traveling to different counties, so they have decided to come to work for the county.
That's lucky
way to go.
You must have been able to fill those positions pretty quickly.
No, it took almost a year. The 2 appraisers retired last spring, and I just got them hired March and April. And the COVID had a lot to do with that too, because we stopped some of our processing, and there was no need bringing anybody in during that time. So now we're playing catch up, but we're getting it done. And we will have that 2023 reappraisal finished.
Wow. All right.
All right, any questions? All right, thank you.
Thank you. Michael Rowland?
Thank you, Mr. Chairman, Commissioners. I guess before I get started with IT, I got to support Deborah. I work closely with her folks on billing and listing and then collections. And the brain drain that she's experiencing is incredible. So whatever assistance you can provide her would be greatly appreciated. I would appreciate it too. So I guess I'll get into the IT budget priorities. For 21-22, we have 2 additional positions we requested. One was a public safety business analyst and an infrastructure services specialist. The infrastructure service specialist is critical. We just completed a cybersecurity assessment with the North Carolina National Guard, and that was one of the most comprehensive security audits I've ever been in. They came back with 3 main areas that we need to work on to improve. These were vulnerability assessment and patching, auditing, and policy refinement. The problem we've always had in the past is we've just never had the staff to spare to be able to focus on these areas. And so the time's come, we see it every day, where network security is paramount. I saw something the other day that ransomware was a $6 trillion business nowadays. We've seen where Colonial Pipeline paid $4.4 million for a ransomware attack. JBS paid $11 million. So this position will go toward helping us increase our security. They will take some of the day-to-day work off of our network administrator, who is a higher level position with that higher, more advanced skill set. And so he will be having some time to focus on that area. We've actually got several projects planned for this upcoming year that will focus on security, especially the auditing, backups, those types of things. So that is a critical position for us. The other position was the public safety business analyst. We originally requested this position back in 18-19 fiscal year. It wasn't approved at that time. So to meet the need, we went back and looked at our staff, and we moved staff around. We gave additional duties to some staff, and that was successful for projects. We just completed a jail management software upgrade. It took several IT staff to complete that. That was very large, but we were successful doing it. The problem is it doesn't help with our day-to-day work. So our public safety, we have one public safety specialist. She's handling 20% of our help desk tickets right now. So the first 6 months of just this year, she handled 20% of our help desk tickets. That's more than we should be asking for one person to do. Public safety is a broad area. It encompasses several different software packages that we support. Between the sheriff's office, jail, emergency services, emergency management, 911, emergency medical, all the fire departments, all the law enforcement agencies, we support all those folks. So we're putting a lot of work on one person. So we're asking for an additional public safety business analyst to work with our public safety specialists to help with that. Now, the proposed budget includes the new infrastructure services specialist, and thank you, Hal and Will, for including that. That does help a whole bunch. It also includes a reclassification of our public safety specialist to a public safety analyst, which that helps as well. We're asking that position more and more and more and putting a lot more on it, more advanced work, and this will help make that better. But what I would request that is, instead of the reclassification, that we include that business analyst position, that new business analyst position. It is really needed. I appreciate you considering that. I know budgets are stressed, and I appreciate the work you put into it. And thank you so much for your continued support. I can answer any questions.
Okay, questions? Mike? How secure do you feel? I'm serious. How secure do you feel? Be perfectly honest, it's not if, it's when. It's when?
It's when. You know, we do a lot of things. Security awareness training, that is one of our biggest areas. The weakest link in all of our security is the person at the end of that screen. And I've got to give kudos to our county manager. He received a spear phishing email the other day. A spear phishing email is an email directed at one specific person, usually an executive. And they're looking for them to click on a link, open attachment, which is what his email included, and it downloads something and starts doing and spreading, and then before you know it, you're paying $11 million to get everything back. The county manager spotted that and saw that it was a phish and deleted it just like he was supposed to. That is where it pays off. Our security awareness training pays off. All county employees go through that annually. All new county employees do it at new hire. So that is one of the things we've put in place. And the National Guard was very, very good to see that. But we've got a lot of other areas that we need to work on. So.
Bring to your attention